Here's 10 ECG basic rhythms. I'm gonna go over the treatment for them all. You won't find a better video than this anywhere on the internet. So let me explain it to you. Here's sinus rhythms so you can compare all of these. And first we've got bradycardia. So for this you'd give atropine IV, and you can also use infusion of dopamine and epinephrine to raise the blood pressure. If that doesn't work, you can use transcutaneous pacing, and they might need a permanent pacemaker if they're still symptomatic. If this video helped you, please give me a like and a follow. There's usually a cause, so you'd want to treat this if it's something like pain or sepsis. Then you can always use a beta blocker, these end in LOL, or a calcium channel blocker. Here's 10 ECG basic rhythms. Do you know the treatment for ventricular fibrillation? You won't find a better video than this on the internet. This is deadly, it's an emergency, and it's a shockable rhythm because no blood is being pumped around the body. Give CPR and defibrillate the patient, and you can give epinephrine, and you might need to implant an ICD after. Next one is VTAC. If you think you know the treatment, put it in the comments. It'll be out in part 4. ECG basic rhythms is a ventricular tachycardia treatment. You won't find a better video on the internet. If the patient has a pulse and blood is being pumped around the body, you can give amiodarone and synchronized cardioversion. If there's no pulse, that means blood isn't being pumped around the body. It's an emergency, and this is a shockable scenario. So you do CPR and defibrillation, and you can give epinephrine. The next one is atrial flutter. If you think you know the treatment, put it in the comments. Otherwise, stick around for part 5. There's some ECG basic rhythms. Do you know the treatment for atrial flutter? You can control this with medication like a calcium channel blocker, a beta blocker, or in heart failure, digoxin is really good. Use an antiarrhythmic like amiodarone. And with this, blood can pool in the atria, so you want to use an anticoagulant like warfarin. If they're unstable, synchronized cardioversion can be used. And if this isn't working or is contraindicated, then the last option is cardiac ablation, where you burn off the tissue causing the atrial flutter. The next video is atrial fibrillation. If you know the treatment, put it in the comments. Otherwise, it's going to be in part 6, so stick around for that. Do you know the treatment for atrial fibrillation? You won't find a better video than this on the internet. If the patient is stable, you can just monitor them, and if they're unstable, you can use synchronized cardioversion to try and put them back in a normal rhythm. You might need to use anticoagulants like warfarin because the blood can pool in the atria and cause a clot, and if you are doing cardioversion, you'll need to definitely use this after. You can also do medical cardioversion instead of synchronized, which is usually used with drugs like diltiazem, adenosine, and amiodarone. Again, you need to manage the rhythm after with something like a beta blocker, these end in LOL, or a calcium channel blocker. And if this doesn't work, then you use ablation to destroy the part of the heart that is causing the problem. If this helped, give me a like and a follow. The next one we're doing is SVT. Here's 10 basic rhythms on the ECG. Do you know the treatment for supraventricular tachycardia? So if they're stable, you've got 4 steps, and you want to keep them on a continuous ECG monitoring. Number 1, the Valsalva maneuver. Number 2, carotid sinus massage, and then you can go on to 3 and 4. 3 is adenosine or verapamil. These slow the cardiac conduction and reset sinus rhythms. They're actually pretty scary drugs as they go into a brief period of asystole beforehand. And then 4, you can do electrical cardioversion. With adenosine and verapamil, the patient can actually get a big feeling of impending doom. So you want to let them know before you give it to them that they can feel this. If they're unstable, you can use synchronized cardioversion with or without amiodarone. You want to make sure this is synchronized, because if it's not synchronized and you put a shock on a T wave instead of a synchronized shock which is synchronized to the R wave, it can actually go into ventricular fibrillation, which is far worse. Other kind of SVT, which is called paroxysmal, this is like episodic SVT, and you can manage this with a beta blocker, calcium channel blocker, amiodarone, or if you want to cure it completely, radiofrequency ablation, where you burn out the tissue that's causing the problem. If this video helped, please give me a like and a follow, and the next one is Torsades de Pointes. Stick around for that. This is Torsades de Pointes. It looks like the Arctic Monkeys album cover, but do you know the treatment? For this, you give magnesium sulfate, and you want to stop any medications that prolong the QT, like amiodarone or propanamide. If they're unstable, you give CPR, cardioversion, defibrillation, and they might need to implant an ICD afterwards. If this video helped, give me a like and a follow, and the last one in the series is asystole. We're doing that next. This is asystole treatment, the flat line. It's the most dangerous. It's actually not shockable, and this is an emergency. This is the last video in this series, and I'm going to let you tell me how to treat it. Put your answer in the comments, and I'll let you know if your patient is going to die or if your patient is going to live. Throwing out all these rhythms has helped me so much with learning them and visualizing them. If you're interested, click the link in my bio. I've got tons of other sheets that are really cool as well.